A very warm welcome to my students who is watching the lecture. My name is SHravani Bhattacharyya and I work for the Faculty of Humanities and Social Sciences at Assam Downtown University. Today's topic of lecture is taking you through the first practical of the semester, which is Beck's Depression Inventory. But before we start talking about I want to orient you towards about what is depression. Depression refers to the feelings of sadness, low mood, and loss of interest in usual activities that marks a change from a person's previous level of functioning and have persisted for at least 2 weeks. So you would need to pay a very close attention to the symptoms that are being shown by the respective clients and also how is the current symptoms affecting their day-to-day life, followed by the duration, how long were they experiencing or are experiencing these symptoms. And to go in a much more further detail, DSM-5 has laid down certain symptoms for us to understand it better. So it says that these feelings must be accompanied by at least five other common symptoms of depression. So you need to, at least if you have five symptoms from this list, you can provide the diagnosis that the person is experiencing depression and requires further treatment. The very first of it is change in appetite, losing or gaining weight, sleeping too much or sleeping too little, fatigue and low energy, feelings of worthlessness, helplessness, hopelessness, and guilt, an inability to focus and concentrate that may interfere with daily tasks at home, work, school, movements that are usually slow or agitated. So, if you notice this one symptom, it is a characteristic feature called as the psychomotor retardation. So, this usually means that the person has become really slow and the person also gets agitated very quickly. Um, and people, the outside, the third party people, would be able to observe these changes the most. This is a very significant change in depression. The next symptom is thoughts about death and dying. There could be suicidal ideation where the client is thinking about ending their lives, and suicide attempts, the actual act of committing the suicide. These symptoms must cause the individual clinically significant distress and impairment in social life, occupational lives, and personal life. Moving on, we come to the differential diagnosis. So, if you notice, what is differential diagnosis is it is a process of distinguishing a particular disease, disorder, conditions from the others that can also present similar clinical features. So you're ruling out that these particular symptoms are because the person is experiencing depression and not due to any other condition. So what does the differential diagnosis have to be? They must not be a result of substance abuse or any other medical condition. The doctors must also rule out the other mental health conditions that could have a depression component, but they are not a major depressive disorder. For example, bipolar disorder or schizoaffective disorder. To be diagnosed with a major depression, the person must not have a manic or a hypomanic episode, which would then change your entire diagnosis to bipolar disorder. So you have to be mindful of the categories of symptoms you're experiencing, as well as rule out that this person is only experiencing the symptoms of major depression disorder and not of any other disorder. Moving on, we have many changes that the DSM-5 had introduced. So the first of it is with mixed features. So this new specifier allows for the presence of manic symptoms within a diagnosis of depression for patients who do not meet the full criteria for a hypomanic or manic episodes. So if you see that there are mixed features, but they are not, satisfying the criteria of the bipolar disorder. So you would be putting it as a major depressive disorder with mixed features. Again, another change they had introduced is with anxious distress. So this specifier was added to account for the presence of any kind of anxiety, tension, or restlessness with the potential to impact the prognosis as well as the treatment options. This is a very important change in DSM-5, which says that the way the chronic depression is conceptualized, it should be very much distinguished from an episodic depression. So you have dysthymia, earlier called as dysthymia, it's now under the umbrella of persistent depressive disorder. And this persistent depressive disorder will also include the chronic major depression, for which the researchers who have actually constructed or provided evidences to build the DSM-5, they did not find any significant difference between dysthymia and chronic major depression. So all of these symptoms, they come under one major umbrella now, which is called as the persistent depressive disorder. Now, this is also something that you must know is the DSM-5 removed the bereavement criteria. So, in the past, depression symptoms lasting less than 2 months following the death of a loved one would not have been classified as a major depressive episode. The new edition of DSM now acknowledges that there is no scientifically valid reason for treating the grieving process any differently from any other stressors that can trigger a depressive episode. Okay, so we all have, or we are all given the Beck's depression inventory, and a little introduction to the inventory is it is a self-report inventory which was been constructed by Beck, and this inventory is self-scored, or the client reports or writes down the ticks the items by themselves. So when we are administrating the test, you as a psychologist will sit parallelly from the client, and you would have already a BDI inventory with you, and you would hand out another inventory form of the BDI to the client, so that you don't take when you're explaining or when you're giving the instructions, you don't take a look at the client's BDI inventory form. You would already have a form with you, present in with you. Also make sure that the environment in which you are administering the test, it has to be silent, it has to be well ventilated, there has to be adequate amount of light, and when the client enters the room, greet the client with courtesy and ask as to how her day was. Try to build rapport with the client who is sitting in front of you, and immediately do not straight away jump to uh, giving out the instructions on the BDI from the BDI inventory. Try to take some demographic information of the client, such as name, gender, sex, address, emergency contact number, and the important primary concerns. If they are not vocalizing and they're showing major symptoms of psychomotor retardation, you can ask the primary informant of the client to state, primary or the secondary, whoever has brought in the client, to state the primary or the chief concerns that the client has been experiencing since the past 2 weeks or several months. So you would put down on your notepad, which you will have it with you. Followed by that, you give out the inventory and you ask that these are some items which are given to you on this sheet of paper. There are a total of 21 items, and each item has a scoring of 0, 1, 2, 3, which are different uh, according to the item which is present in the test. You will have to read the item and score the one which is you feel is most appropriate to you. So this is, since this is a self report inventory, you will need to score it out yourself. In any condition you require assistance, please reach out to me and I will be there to help you in any way I can. So you hand out the Beck's depression inventory and by stating the instructions verbatim to the client and allow the client to go through the BDI inventory and then start working. Also mention that it is not a time bound test, so you can take time as much as you want to score the test, but you must give the answers that are very true for yourself, and anything that you share with me will be kept completely confidential. So with this, you administer the test, and as the test administrator, you would already have, the scores that are being marked by the client for each of these items. So you would have to then add up the scores for each of these items, which would then give you a total score. And this total score, as you can see here, I have put it down from 1 to 40. It indicates a different level of depression. So if the client's total score is between 1 to 10, it means that there are certain ups and downs that the client is experiencing, but these are normal and the client will be able to overcome with adequate counseling sessions. If the client is between the client score is between 11 to 16, then it indicates that there can be a mild mood disturbance problem. So you would need to plan out your treatment according to this. From 17 to 20 means borderline clinical depression, just on the verge of having a major depressive disorder. And from 21 to 30, it's moderate depression. 31 to 40 is severe depression. Over 40, it's extreme depression. So based on the total score, you would have each of these interpretations uh, for the client. Now, in your practical file, you would be required to write down the results, and a table should be constructed with the two columns that are being mentioned, obtained by the client. Okay, so here it first of it is the raw score, whatever the client has got received on the BDI, and then the interpretation based on what we had discussed in the previous slide. In your interpretation, you are required to first start off with the client's demographic information, and then you talk about what does the BDI measure and what it is, how reliable or how valid it is, followed by you put the total score that is being obtained by the client, and then you write an interpretation of it. Followed by these two things, you are required to also write about the particular details that of the symptoms of depression that you have gathered from the case history taking that you had done previously in during the first session with the client as well as with the primary informant. So you are going to triangulate the data in order to give a good holistic picture of the client symptomatology, and then you would end with recommendations for his, her, their treatment, and also you would talk about prognosis. What is the scope of the prognosis, scope of improvement in the short term as well as in the long term? So, you might have noticed that I have given his, her, or their here. Their is mostly refer to those individuals who are not comfortable with using the pronouns like his or her. And as psychologists, we must be very updated with the gender identification of the people. And we know that now there are no two watertight categories of only the client being in the male or the female category. Anyone can have gender apart from these two categories. So this is meant as a pronoun for the such individuals. So based on this, you're going to put down your recommendations, your the treatment plan. What are you planning? So if you want to refer the client to a psychiatrist, you have to put down that, uh, for instance, the client falls in the level of severe depression and requires immediate intervention or psychiatry. So you would be putting that down, and also you would be outlining the number of sessions the client requires per week on an emergency basis. And then you would be concluding with a prognosis, that is, what is the level of improvement that you would expect, that you're expecting for the client in a few months, um, and also how much do you think the client is capable of improving in the long term. So in the prognosis, you would have to mention the level of the individual motivation, the personality of the client, the social support the client has, the whatever the psychological resources that the client has. So you would be combining all of this and you would be writing the prognosis report. Okay, and ending with a conclusion, you would be just in 1 or 2 lines, you would give a short description of the scores that the client has obtained and the interpretation of the level of depression that the client has. So, with this, I end today's lecture. I hope that you were able to understand this. I would be sharing the PPT with you during in the classes so you can have a closer look at it. Any kind of question, please feel free to email me at shravani.bhattacharya@gmail.com. Thank you so much for patiently listening. I hope you have a good day.